Discussion on SAMe-TT₂R₂ score for poor INR control. SAMe-TT₂R₂ score aims at predicting those likely to have poor INR control while on vitamin K antagonists. The investigators divided the AFFIRM trial cohort randomly into a derivation cohort and an internal validation cohort. Please subscribe to this channel for future updates. Click on the subscribe button. Press the bell icon after that for all updates. They used linear regression analysis to find out the clinical parameters associated with time in therapeutic window while on warfarin. Binary logistic regression analysis was used to evaluate the predictive performance of a model created using these factors. The prediction model was externally validated using a prospectively recruited cohort receiving anticoagulation. SAMe-TT₂R₂ score derived thus had the following parameters: sex female, age less than 60 years, medical history more than 2 comorbidities, treatment, interacting drugs, example amiodarone for rhythm control, tobacco use doubled, race doubled. Those with scores of 0 or 1 did well on warfarin with good TTR. In those with a score of 2 or more, additional interventions are required to achieve adequate anticoagulation. Direct oral anticoagulants may be considered in patients with a score of 2 or more. It is not very sure whether this score will do well in those with valvular heart disease, as 95% of patients enrolled in the AFFIRM trial did not have valvular disease. Lip and colleagues evaluated 4,637 patients who were receiving vitamin K antagonists to see whether SAMe-TT₂R₂ score could discriminate those who were likely to have a labile INR, stroke or thromboembolism, clinically relevant bleeding, and death while on treatment. They found a significant increase in risk of severe bleeding in patients with a high SAMe-TT₂R₂ score more than 2. Increasing SAMe-TT₂R₂ score was associated with an increasing risk of labile INR, stroke or thromboembolism, severe bleeding, and death on follow-up. Mean follow-up period was 1016 days in that study. Another study, which retrospectively checked 911 patients with non-valvular atrial fibrillation on vitamin K antagonists, also reached similar conclusions. They found that SAMe-TT₂R₂ score is a clinical tool useful to identify patients who have poor quality of anticoagulation control. SAMe-TT₂R₂ score successfully predicted the composite outcome of major bleeding, thromboembolic complications, and death. Here are a few important journal references. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.